Molaodi, can you kindly please introduce yourself and maybe in short tell us what oral health is?
As you said, my name is Dr. Molaodi. I'm the senior clinician at Mental Star Dental Clinic. And you said oral health is all about oral hygiene of the mouth, which incorporates the teeth, gums, tongue, everything on the oral cavity.
So how do you assess or diagnose oral health?
Let me say, just maybe I'll answer your question in a scenario. Let me say you come to the clinic. The first thing we do, of course, it's you sit on the chair, and then get to know the problem. Of course, a lot of people come here, normally there's already a problem, a toothache and all that. But the assessment, the first thing is to I ask the patient to open their mouth. It's called clinical assessment. I use my eyes to look into the patient's mouth. The teeth, the tongue, the gums, everything inside the oral cavity. That's clinical assessment, right? And then of course, in the clinical assessment, sometimes I need to do further investigations, like take x-rays, maybe do a biopsy or whatever, any further investigation that I need to do to arrive at the diagnosis of what really causes whatever pain or presenting complaint that the patient comes with. So yes, the assessment is like that, just the clinical assessment with the small mirror that we normally use and the probe. We assess all the structures of the oral cavity. If a patient comes in, there's a toothache, we'll look the side where he's complaining about the toothache, right? Get to know, okay, is there a hole that I can see with my naked eyes? Of course, sometimes there are times that a patient complains of a pain, which I can't see with my naked eyes, so I have to do further investigation. I have to take an x-ray, I have to do other TTPs or other investigations that we need to do. Yes.
So I also heard that diet has an effect on dental. So what are other causes of dental health?
Yeah, there are many, but of course, as you said, diet. We eat. So food goes through the mouth because we eat. So diet, because it's the main part of what we eat. And of course, sugary food is the main cause of tooth caries, because there are oral health diseases that I see patients presenting with, being tooth caries. Tooth caries, of course, it presents with pain, and also the other one is gum disease. Normally it presents with bleeding gums and all that. And of course, there are also traumas. Someone has a road transport accident, they'll come with trauma, or a kid falls and they bite their tongue. So those are other things, but the main common ones is the toothache, which is normally due to caries. It points to the food we eat, especially sugary food, because this is the thing, maybe just to put it in simple terms, we have a lot of bacteria inside the mouth. These bacteria that are called commensal, they should be there. They are part of the microbiota, which makes up the oral cavity, right? But this bacteria, sometimes we eat too much sugar. They're having a party because they eat this sugar, but the problem is what they pass out, or what they excrete out or poops out, it's acid. This is the acid that makes holes in your tooth. That's why we always preach against too much sugar, or repetitive exposure of your teeth to sugar. Let me say in the morning you had your tea, right? You put sugar. Around 11 you snack something that has sugar. Lunchtime you eat something that has sugar. So you're always, the bacteria are always being loaded with sugar, which they eat. Whatever they poop out is acid, which is detrimental to your teeth. You get what I'm saying? So at least if we are limiting, so there are ways that we always preach as clinicians or dentists to say, there's no how we can totally cut off sugar, that one we know, but at least reduce the exposure, or snack on healthy things, We'll get into that, I believe, later on what can be done, especially kids like sugar. Even adults, we like sugar. Like I said, we know that you're not gonna be 100% cut sugar, because we need it for our tea, we need it for a lot of things. But at least if you reduce the exposure of the sugar, maybe snack on healthy things like milk products, yogurt, something that is cheese, because they have calcium, right? Calcium is one that replenishes your teeth. After the bacteria tries to make holes in your teeth, if you have calcium, the calcium helps to replenish your teeth. Remember, good calcium is good for strong bones and teeth. teeth is a bone. So if you snack, you cut on sugar and you replace where you normally have sugar, or let me say chocolates and all that have sugar, at least have snack something with yogurts, like something like yogurt, cheese crackers, because they have calcium. So you replenish teeth instead of what? Destroying your teeth. Yes.
Thank you so much. Dr. Molaodi has told us the causes, the symptoms, and the diets that affect tooth decay. So catch up with us after this break. Welcome back to Botsogo Boswa. We are still continuing discussing about oral health. I am with Dr. Molaodi from Middle Star Clinic, who is a dentist. Dr. Molaodi, I have been wondering if is it true that we should brush our teeth 3 times a day, and maybe give us the correct way on how we should brush our teeth.
The standards or regimen for good oral hygiene or taking care of your teeth, we recommend that to brush your teeth at least twice a day with a fluoridated toothpaste. Flossing at least once a day, and then using non-alcoholic mouthwash, or a mouthwash that doesn't contain alcohol. Okay, there are different types of mouthwash, there are different types of toothpaste. You go to the supermarket, there are different types of toothbrushes, but we normally recommend the soft bristle toothbrush, that you have to use a soft bristle toothbrush, because if you are using a toothbrush that the bristles are hard, you're actually damaging your gums. You know, I normally see a lot of clients with gum recession. Gum recession, think of it as soil erosion, you know, when the soil has gone away. So it can actually erode your gums when you use a toothbrush which has hard bristles. Especially gentlemen, you know, with their biceps and all that, they're using too much force on the toothbrush. Of course, they are doing it, ideally they want to clean their teeth, they want the teeth to be clean, but they don't realize that the white part is on the pink part. So you can actually erode the pink part by using too much force, trying to brush this white part, and unfortunately damaging the pink part, being the gum. All right, and the gum is the one that is holding the tooth, right? So like I was giving an example with soil erosion. You've got a tree and the soil washes away, that tree is going to fall off. So same thing with your tooth. If we are using too much force, or you're using too much force, and also imagine the bristles are hard, so over time the gums are going to recede. You call gum recession, and then you will end up, most of the time you'll see by the teeth becoming longer. It's like the teeth are longer because the gums have receded, the gums have eroded away, and ultimately the tooth becomes loose because you've actually eroded the gums. And talking about correct brushing, I know we normally recommend bus technique, or brushing in circular motion, because if you brush like this, you're actually not cleaning. You have to be brushing in circular motion. You get what I'm saying? Circular motion like that, up, even outside, and then you open your mouth, you brush on the chewing side, still circular motion. And then same thing on your lower jaw, you're brushing, circular motion on the chewing side, all the way. And of course, people normally forget the tongue. You know, take your tongue out, you brush your tongue. You know what I'm saying? Because think about it, especially for ladies, you'll understand this. If you have your afro comb, right? Let me say these are the afro comb, right? So there's hair stuck in between. How do you take it out? Normally you'll take a tissue and take it this way. You don't take it out this way. So think this is like afro comb, an example of the afro comb. These are your teeth, right? So food are stuck in between, and you brush like this. So you actually not doing anything, but if you're brushing in circular motion, there's a point where the bristles actually flicks the food that is in between the teeth out. But if you are doing this, you're actually just cementing that food in between. You know what I'm saying? So that's why we recommend what? The bus technique, or circular brushing in circular motion. Because there's a point when you are doing circular motion like this, there's a point where the brush bristles actually flicks off, right? Flicks off any food that is in between. They flick off by the circular motion. Okay? And of course, I was talking about the different toothpaste. I normally get asked by my clients, what's the best? The best toothpaste to use is the one that has fluoride. And the standard, or WHO standard, every toothpaste company has to have 1450 ppm, parts per million of fluoride. That's the recommended or standard amount of fluoride that your toothpaste should have. Which one do you pick? You see there's herbal, there's optic white for whitening, there's charcoal and all that. But all of these, the active ingredient is the fluoride content. The fluoride content is the most, for me as a dentist by the way, the fluoride content is the most important, because the fluoride content, it helps the calcium to go in. The fluoride is the vehicle that gets the calcium into your tooth to replenish or to strengthen your teeth. With fluoride, you have a vehicle that helps this calcium to go into your teeth so that your teeth become strong. Hence, we need the fluoride. In other countries, they actually have what we call fluoridated water. They put fluoride in the water. But in Botswana, our underground water has a lot of fluoride. We don't actually need to do water fluoridation. But in other countries where their underground water doesn't have fluoride, they actually put fluoride in the water to help. It's like medication for everyone. So we have plenty of fluoride in our water, but still, when we are brushing, like I said, we have to use a fluoridated toothpaste still. So it's very important. And also, like as I mentioned before, you have to use a mouthwash. There are different types of mouthwash. The most important component of your mouthwash is the chlorhexidine, the antibacterial part, and also it has to be non-alcoholic, because there are other mouthwash that contains alcohol. The problem with it is that it will dry your mouth quickly if there's alcohol. We are rinsing your mouth with a mouthwash that has alcohol, your mouth tends to dry off easily or quickly. And we don't want a dry mouth, because if you have a dry mouth, then because the saliva helps to be cleaning your teeth throughout the day. But now, if you don't have saliva because you're using a mouthwash that is alcohol, your mouth is dry. And of course, there's also halitosis, bad breath. If you have a dry mouth, you end up having bad breath.
That's a good thing, because I'm one of the people who normally brushing teeth so hard, I think. So that's a good lesson. Let me say, home remedy, do you prefer them to use in case of emergencies?
Home remedies work, but we are not taught at school for home remedies. I'm taught at school for what should be applied at the dental clinic. But of course, like you say, in a setting, village setting, or someone is far from seeing a dentist or a doctor, there are cultural things that we know. People use charcoal and salt for brushing. That we know from when you're young, or from the old times. People use the roots of the letlhajwa for that, because whatever will work to clean your teeth. Remember, brushing twice daily. If you maintain brushing twice daily, a lot of problems will be actually taken care of. But of course, like you're saying, in emergencies, someone has a toothache and all that. Obviously, pain means painkiller. If you can have a painkiller, you go to the nearest clinic, where maybe in that clinic there's no dentist or there are no dental services. At least they'll give you a painkiller in the meantime to take care of the pain. Because if you have a toothache, the main problem is the pain. Maybe before you get to see the dentist, you have a painkiller that will help. But you still have to go to see the dentist so that he can do the proper treatment. Okay. And last but not least, like I said we said about the oral regimen, brushing twice daily. Okay. Using all these soft toothbrush, fluoridated toothpaste, and rinsing with a mouthwash, and also using floss. You have to also floss, because food gets in between. Sometimes the toothbrushes, the bristles, they're too thick to get in there. So you need a floss. A floss is like a stream that will now go in between. If you get that, a lot of things will be taken care of. And of course, the other thing is very important for people to visit the dentist at least twice a year, every 6 months. We have to make it a habit to go visit the dentist. Why? Sometimes there are things that you as a layman, you won't be able to see, but the dentist will be able to see, do investigation well in time before the situation goes out of hand. They say prevention is better than
Sure.
Thank you. Because now sometimes you go to the dentist, it's too late. You have to cure. Curing means sometimes taking out your teeth, or means expensive things like root canals and crowns. But if you went earlier, we could prevent the decay. Preventative fillings like fissure sealant. There are a lot of preventative measures that we can do on the tooth before the decay goes out of uncontrollable, or you lose a tooth. So prevention, like you said, is better than cure. So and it's very important that you visit the dentist at least twice a year, every 6 months.
Dr. Molaodi has emphasized that we should use fluoridated toothpaste and soft toothbrush and at least visit the dental clinic twice a year.